accurately. Hospital Monororanjan 25-26 minutes. 25 meeting তার পরের দিন আছে তার আগের দিন আমাদের Good afternoon, Dr. Chopra. Good afternoon. Good afternoon. Sir, good afternoon.
Good afternoon. How are you? Happy Doctor's Day to everyone.
Very happy Doctor's Day.
Everyone. God bless you.
Dr. Chopra.
गुड इवनिंग चोपड़ा सर कैसे हैं?
Good evening. Happy Doctor's Day, Dr. Tiwari. How are you?
थैंक यू सर.
Good afternoon, sir. Good afternoon, sir. Dr. Sinha here. Professor Bhattacharya, can you hear us?
Yeah, I can hear you.
Yeah.
God bless you. God bless you.
Dr. Bhattacharya mute আছে
Am I audible now?
Yeah. You are audible. Professor Bhattacharya sir will be starting shortly. We are waiting for the technical support team to
Sure.
work. Just be asked for a couple of minutes.
Okay, fine.
Let me introduce Professor Dr. Chiranjeev Bhattacharya. He is a Vice Chancellor of Jadavpur University, Kolkata, West Bengal. We know that Jadavpur is one of the best universities in the country, and he is heading this university. So thank you, sir, for giving us the consent for talking on the occasion. And we are waiting patiently to listen to your chief guest lecture. So we'll start is the tech team ready for the thing? No, not yet.
Sir, 1 minute to go, sir. 1 minute to go.
Yeah.
Sure.
I think several participants join online also.
Yeah. Yes.
Okay. Where is this conference room? At which location?
It is just opposite to ESI Hospital.
Yes,
By
sir.
the side of one PC Chandra's.
Okay.
In the Kakurgachi, CIT road.
I know it very well.
Yeah. This is the headquarters. Yeah. This is the headquarters,
So
sir.
there, I used to stay at Kakurgachi during my childhood.
Oh, great.
So the place is known to me.
I am Dr. Divan Kahali. I am the president of the society. And many presidents are here. Dr. Parthu Sharbi Banerjee. You know Dr. Sinha. He is the secretary. And Dr. Vinod Das. He is the ex-president. Dr. Monororanjan Mandal, professor. He is the treasurer of our society. Homitra Roy is the vice president. Dr. Devabrata Rai, you must be knowing him. He is a great stalwart of our society, and he is the international coordinator and also executive committee member, and also holds very important positions in the society. Dr. Vishwajit Bhattacharya, he is the professor. Vishwajit Mojinder, he is the professor. Professor and HOD of Armithor Medical College. Dr. P.C. Mondal is the HOD of Apollo Hospital, Cardiology. and Professor Kajul Ganguly was heading many hospitals in the city like NRF Medical College, etc. And he is at present in practice and he is a very busy cardiologist. And there we can see Dr. Chopra. He is a very noted person and he was also the president of Cardiological
Sir.
Society of India.
Sir, we are ready now. We are live.
Yeah. Dr.
We can-
Sanjay Raghi, who was the immediate past president and a great friend of our society, and also Dr. Satyen Tiwari.
Okay.
So let us start the proceedings. So I greet all of you.
Can you start, sir?
Yeah, you can start with the cartoon video.
So I am
Nice
Dr.
video.
Kumar Ali, President of Cardiological Society of India. I greet all of you, all the ladies and gentlemen, and also thank you all for coming on the occasion of celebrating the birthday of a great leader of our Dr. Bidhan Chandra Rai. Dr. Bidhan Chandra Rai was born in this particular day. He was also the president and founder president of this society, Cardiological Society of India, which was formed in Kolkata in 1948. So it's a very old society and it's older than American College of Cardiology. ACC is a very big society. They have great numbers, 33,000 members, but we are senior to them in age. Anyhow, he was a great statesman, not only a great doctor, a great visionary, a great statesman, and Durgapur Steel Plant and Gollani and everything in what we see in modern West Bengal is because of him. He was also a great doctor, great physician. He believed in the clinical acumen and he diagnosed so good that it's an enigma now that he was a great doctor. And we all follow him. He was a follower of great ethics, which we must remember. And he used to see majority, almost all the patients free of cost. And even being the chief minister of West Bengal and a very important designate in the central government, he gave a lot of time, almost daily, he used to see patients. So that shows his great profession. His knowledge was great. So anyhow, on this particular day, we respectfully give homage to this great gentleman of West Bengal and also India, Dr. Bidhan Chandra Rai. And we also tell that we are trying to follow his pathway in Cardiological Society of India. And we have been doing so many constructive work, especially with Dr. Devabruta Roy and all of our friends, Dr. Sinha, Dr. Banerjee, Dr. Manoranjan Mondal, Vinal Gantidas, Vishwajit, all of us, we are trying to go penetrate. One of the problems in our country is rampant coronary artery disease, and it is prevalent among the very young. I had the occasion of doing a very thin lady, 37-year-old, plastic after a heart attack. Yet she was admitted with a massive heart attack day before yesterday night. And anyhow, we could save her and she's fine. So how to prevent the disease? Because, treatment is becoming very expensive. Today also we have heart. That's why, can you give little cheaper medicines? So I told, no cheaper medicine than this is available. And you are getting the foundation therapies, all essential guideline directed medical therapy. Okay. So in this country we are living. So we have to think at each step about the expenses. Our population is 1.45 billion. But I'm proud to tell, as president of the society, that all of us are trying very seriously to take the cardiological care to the doorsteps of this population. It's a huge work. We are trying preventive work. We are going to the schools. We are going to their teachers, to their guardians, to their neighbors, and propagating the idea of primordial prevention, primary prevention, and secondary prevention. I don't want to make my lecture long, but by giving homage to this great person and to all my colleagues and to extend my best of wishes to all my colleagues and the unity and integrity of Cardiological Society of India. Long live CSI. Jai Hind. I would I would now ask the technical team to show the garlanding of the Dr. B.C. Roy statue, which is there in the ground floor of our Indian Art House. So we have seen the garlanding of the great person, Dr. Professor B.C. Roy. And now I would invite Professor Dr. Chiranjeev Bhattacharya, who is the Vice Chancellor of Jadavpur University, Kolkata, West Bengal, and a great academician, to give the chief guest lecture. So, Professor Chiranjeev Bhattacharya, please.
So thank you very much. It's a privilege to stand here today on the occasion of the Doctor's Day and speak about the significance of Doctor's Day celebration and its societal impact. I am from Jadavpur University. Presently, I am the Vice Chancellor of Jadavpur University, but I belong to Jadavpur University as a faculty, and I am serving here basically for more than last 3 decades. I am a professor of Chemical Engineering Department Jadavpur University, but after that I served a different administrative position for over last 10 years or so at the level of Dean of Faculty of Engineering and Technology, then registered, then Pro Vice Chancellor, and in between I served as a chairman or the president of West Bengal Council for Higher Secondary Education, that is Ucha Madhyamik as it is called. I was the president of that also, and presently I am the vice chancellor of Jadavpur University. So it's an honor for me to speak on this particular occasion. First and foremost, I extend my heartfelt gratitude and warm wishes to all our doctors whose dedication, compassion, and tireless service continue to protect and improve the countless lives. This day is not only to celebrate your expertise, but also your commitment to building the healthier communities. National Doctors' Day is celebrated every year on 1st July in India, marking 35 years since its inception in 1991. It honors the legendary doctor, Dr. Bidhan Chandra Rai, a physician, a freedom fighter, and a politician and an educationist. He was a great visionary also because he conceived the idea of Salt Lake, the Bidhan Nagar, as we know it now, also the Durgapur, Kalyani, and many places. Dr. B.C. Rai was born on 1st July 1882 and died on 1st July 1962. A strange coincidence also. From our childhood also, we came to know about this because as I told you a little bit earlier, I used to stay at Kakurgachi and I went to the Bidhan Chandra Shishu Uddan. And there I have seen that the birthday and the death anniversary both are on the same day. So it's a strange coincidence also. On the 4th February 1961, he received the highest Indian civilian award, the Bharat Ratna. He gave his life to the people, treated many individuals, and inspired millions. He was also the personal physician of Mahatma Gandhi. This year, in 2026, the National Doctor Day theme is Behind the Mask, Who Heals the Healers. So this is very important theme, and this theme emphasizes the utmost importance of recognizing the mental and emotional well-being of doctors who consistently prioritize patient care, often at the expense of their own health. Doctors have a vital role in the society. They devote their lives to patients' well-being, assisting in faster recovery from disease or conditions and improving their quality of life. National Doctors' Day has been celebrated in India to recognize and appreciate the importance of the doctor's role in society. This also helps the general population to know the importance, significant roles, and responsibilities delivered towards the patient's care by doctors. The famous saying is there, the prevention is better than cure. Not only the advancement of modern medicine, but the real achievement in healthcare lies in preventing the illness before it begins. In the context, the community approach to preventive health is highly relevant to this particular point. So this is the particular point which you have mentioned in this particular today's event. The preventive health is not the responsibility of the doctors alone, but it's a shared responsibility of the individuals, families, the communities, educational institutions, local governments, and healthcare organizations. The community-based preventive health recognized healthy communities create healthy individuals. When the communities come together to promote awareness, encourage the healthy lifestyles, and support early detections of diseases, then the burden on healthcare system is reduced and the quality of life improves for everyone. I want to mention a quote of Hippocrates. Wherever the art of medicine is loved, there is also a love of humanity, unquote. So the communities can practice the art of medicine to to contribute in preventive health in several ways. Number one, the health education and awareness. Basically, we at Jadavpur University, we just carry out lots of activities on this particular aspect in the form of discussions about nutrition, physical activities, mental well-being, hygiene, vaccination, and the danger of the tobacco and drugs, etc. In Jadavpur University, we often organize the different workshops on the mental well-being because particularly in any universities or institutes, nowadays, basically the mental well-being is a very big issue, particularly for the students. So we at Jadavpur University organize different workshops on this particular point, as well as different healthcare activities in collaboration with different hospitals, like say for example, previously it was Amri, now it's the Manipal, as well as the particularly Arentego and other hospitals also, with which we are associated. The regular health screening and early detection. This is also very, very important. This is the community health camps, screening programs for diabetes, hypertension, cancer, eye disease, etc. We also at Jadavpur University organize this type of thing, and I am associated with some NGOs also who organize this type of the events, particularly the screening program for the diabetes, eye disease, etc., on regular basis. Now I'm just coming to the number 3, that is the promoting healthy lifestyles. That is access to nutritious food, encouragement of the sports and yoga, and the community fitness program. So we all know that basically the healthy food. Nowadays, most of the diseases are the lifestyle disease. Say, for example, the hypertension, sugar, high uric acid, etc., the lipid. So all these particular problems are related to most of these are related to the lifestyle disease and the taking the junk foods, particularly. The non-alcoholic fatty liver disease is a very common nowadays. Lots of people are suffering. Around 30 to 40% of the people are suffering, the adult populations. So these are basically the lifestyle disease. So basically the access to the nutritious food, encouragement of the sports and yoga. So in this particular connection, the International Yoga Day is also very, very helpful, and particularly in preventing the use of yoga and the physical exercise to maintain the physical health, and the community fitness program. Next is the immunization and the immunization and the child health care. So this is also very, very important. The ensuring the complete vaccination coverage, regular antenatal care, and the child nutrition. So these are very, very important. Finally, the mental health awareness. The communities must create supportive environment where the people feel comfortable discussing stress, anxiety, depression, and the emotional challenges without the fear of stigma. Mental well-being is an inseparable part of the overall health. Basically, we are having some hindrance to share our mental depression or the agony with some other people. We should learn to share. We should learn to just communicate with other people so that we can vent it off. So this is very, very important, and we can get the proper help also in that particular direction. So on this Doctors' Day, we should acknowledge that doctors are the leaders in preventive healthcare. Every counseling session, every awareness program, every vaccination drive, and every healthcare conducted by doctors contribute to build healthier society. On this special occasion of Doctors' Day, we should keep it in mind that the healthiest society is the one where every individual, every family, and every community activity participates in preventing diseases and promoting the well-being. So I thank you all the doctors who are present here, and particularly in the offline mode as well as in the online mode, for your unwavering dedications, your compassion, and your service to the humanity. I wish you all a very happy and purposeful Doctors' Day. Thank you very much. Thanks a lot.
Thank you, Professor Bhattacharya, for your excellent lecture. Though you are not a doctor, but we learned many things from you, from your very structured
I'm not a doctor, but I'm a technologist.
doctorate. Yeah.
Jadavpur University, we are planning to start a course on the medical technology.
Okay.
So that would be a quite unique one. We don't have the just medical faculty in that particular sense, but we want to start a course on medical technologies because nowadays this technological, particularly the use of AI and other tools, as well as the different technological advancement for the medical diagnosis, those are very, very important. And Jadavpur University wish to take part in that particular endeavor. And we want to start a course also in that particular direction. So I have taken the initiative and the state government is also supporting in that particular endeavor. And we should start it soon, maybe from the next academic year.
Congratulations.
Thank you.
Congratulations.
Congratulations.
Thank you very much.
Thank you. Thank you.
On the occasion and giving a beautiful lecture. Thank you.
Thank you very much.
Thank you, sir. I give you thanks from all of us present over here. So next we are passing to our presidential.
So can I leave?
Surely, sir, if you're a busy person.
Because some people are waiting here.
And respect to you, and especially mentioning your beautiful speech. We all of us liked here. You saw that we are all listening to you.
Looking forward to meet you personally on some days.
Yeah. So and hopefully that we'll be meeting soon, and especially in your medical faculty.
Sure. I'll invite you on some occasions at Jadavpur University.
You know, Professor Bhattacharya in the Health University auspices. And
Exactly.
in our hospital are also, there are various technological courses for non-medical persons, but do those like OT technicians and like that. But your AI and these things will be more scientifically backed and little higher level of education. Thank you very much, Professor Bhattacharya.
Thank you.
And hope to see you again.
Thank you.
Thanks.
Sure,
And
sure.
see you.
Thank you very much.
Thank you, sir.
Okay.
Now we are going to presidential conclave on community approaches to preventive health. And participants are all our honorable past presidents of Cardiological Society. And I can see that Professor H.K. Chopra is there, who is one of the senior most. Dr. Sanjay Tyagi, Dr. Venugopal. On my right hand side, Dr. Professor Parthasarathi Bhattacharya, Dr. Minal Kanti Das, and Dr. Anjan Lal Datto, Professor Manutosh Pandya. He is one of the most senior most, and we are surrounded by all the senior members of our society, and this will be moderated by none other our beloved Dr. Satyendra Tiwari, President-elect Cardiological Society of India. So, Dr. Tiwari, you please take over.
Yeah, thank you. Good evening, Mr. President, Dr. Kali, and the senior executive committee members, our secretary, Dr. Sinha, Dr. Debrat Roy, and past president, Dr. P.S. Banerjee, Dr. M.K. Das, Dr. Mandal, and everybody over there for a very important presidential conclave on a very auspicious day of Doctors' Day. First of all, I welcoming you and welcoming past presidents online, Dr. Chopra, Dr. Tyagi, Dr. Venugopal, and other dignitaries. So it's an honor to listen to Dr. Bhattacharya. He is a technocrat and he knows, almost he has covered everything. He knows that now the medical sciences is driven by the technology as well. And after every 5 years, it's growing so fast, especially the cardiology. So moving to the subject, very important. First of all, I request Dr. Chopra, see, from secondary prevention, community approaches from secondary prevention to the model of primary prevention. So how you look at it and what are the challenges to overcome that we should focus more on preventive cardiology right from childhood days. And we all know the very good work of Dr. Debrat Roy, who has done in school-going children for prevention. So over to Dr. Chopra, please.
Thank you very much, sir. I think it was a brilliant question. because I heard Dr. Debrata Roy in the last CSI conference in Delhi. His work I really appreciated. I was there in the full session. A time has come, we should take all initiatives right in the beginning. For example, Healthy Heart Initiative was also taken by Calcutta over 2-3 years ago by one of our colleagues. So everywhere our aim is pre-primordial, primordial, secondary, and then tertiary prevention. And there should be equal percentage of distribution, 25, 25, 25, 25%. Because the diseases actually are in the pre-beginning stage. On the beginning stage, we can create a program so that they can optimize the lifestyle right from the childhood and don't fall victim to the risk factors. And if they fall victim to the risk factors, we should have solution, a remedial solution to take care of the risk factors. So first of all, out of all these is a massive awareness. And I personally feel it will be very nice if CSI take this national initiative of a massive awareness, because CVD is becoming like a global tsunami. And time to act is now before it is too late. And I think we need to focus on preventive cardiology, which is the solution for India. And I'm very happy that Professor Tiwari has asked me this question. And I'm grateful to use early screening in the school should start right from the 4th class or 5th class, their blood pressure check, their lipid profiles, their sugar, and their obesity control. Everything should be started right from the school. Healthy Heart Initiative should commence from the school so that we can reduce the rising menace of coronary artery disease in young individuals in India. Thank you.
Thank you. Thank you, Dr. Chopra. Since you have taken have you done?
Yes.
Yeah.
Okay.
Yes, yes.
Okay. So, in the same challenges of starting the prevention program at the school children, I will request Dr. Debrat Roy to, can you build on this, how to promote this school problem in school going children right from that stage?
I think Dr. Tiwari, we are doing that right now. That if you look at the problem of preventing coronary artery disease in India, there are 3 main issues associated with the 3 is first awareness, second is accessibility to healthcare, and third is affordability of the medicines and the procedures that will be required. So, if you look at the primordial prevention stage, probably creating awareness takes the main seat. But for the other 2, for the primary prevention and for the secondary prevention, you need to address both the accessibility to healthcare and affordability of the medicines. And we have certain initiatives that has been started by the Indian government, like the Indian Hypertension Initiative, which has in its initial phases, it has shown encouraging results. And I feel this should be replicated across India. And CSI can play a facilitatory role in this regard.
Okay. Okay. So that's a very encouraging note. So, Dr. M.K. Das, sir, please. There are increasing burden of non-communicable diseases like hypertension, chronic disease, diabetes, and other comorbidities. Obesity is still a challenge. So how you looked, how the community can play a very important role in reducing the burden of these risk factors?
Thank you, Dr. Tiwari. It's a very, very important issue. I always try to emphasize that so for the epidemiological transition is concerned, actually we have gone from scarcity to surplus state. Scarcity to surplus state. So when 1.2 million years ago, we had the scarcity of everything, whether automation, whether transport or food, or we had to fight for it, and we had to exercise, snatch the things from others. But gradually, the things changed, and there was the surplusness in food, automation, increase in automation and transportation, and everything has reversed. And from community point of view, actually, this point must be emphasized that we'll have to go back to our, if not forest, at least forestly life. So there was one Bengali quotation, I'll translate to that. Rabindranath Tagore himself, he quoted that, "Thou fidaye more aranyo." It means, give me back the forest, because we are not going back to forest, but we have to change our lifestyle. We have to increase the awareness, as I emphasized, and we'll have to transmit the whole knowledge across the whole community so that they can adopt a new lifestyle measures in terms of food, in terms of exercise, in terms of good quality sleep, and thereby they will be able to tide over the crisis that is happening during the epidemiological transition from scarcity to surplus.
So that's a very important idea which you have said. And I'm really honored in today's that our senior past president like Dr. Anjanlal Datta, Dr. Panja, Dr. P.S. Banerjee, and Dr. Venugopal are here along with Dr. Tyagi. So first I will request Dr. Anjanlal Datta, how can the physicians, the doctors, and the other healthcare workers can improve the public participation in preventing the various comorbidities or various health issues? Can you just brief us on that?
Thank you, Dr. Theory. It's a very important issue today. When we talk in terms of prevention of ischemic heart disease, or for that matter, cardiovascular disorder in general, awareness, as we have spoken many a time, is very important factors. But I think from the physician point of view, two important words should come into play. One is survey and the other is service. We need enough data from the survey in terms of risk factors, in terms of incidence, in terms of increasing or decreasing of risk factors. But service should be provided equally. Otherwise, creating data is not going to solve the problems. We have a lot of initiative taken by physicians nowadays. We are going into the research in terms of finding out the incidence and coincidence of different comorbid conditions and risk factors. But at the same time, we should look into it that the patients get the proper service in terms of treatment, in terms of modern treatment. And as Dr. Mrinal Das pointed out, the accessibility of the treatment is very important, and that should be taken into consideration as well.
Thank you, Dr. Datta, for your encouraging and insight into the challenges. I will request Dr. Panja, what are the challenges, what are the barriers, what are the problems one can face regarding the treatment of these comorbidities, and how can we overcome that in the community?
Yes, there
There are lack of awareness and there are challenges.
Yes, very pertinent question. The important issue is the prevention is very important. So prevention started from the child. The old age is a consequence of the childhood, keep in mind. So from the old age, so morbidity, mortality reduction starts the prevention, starting from the 3 S. Sleep to be sufficient, with no 7 to 8 hours sleep. It is act as an anti-inflammatory for the whole body and mind, everything. Second thing, the stress and strain you have to relieve, and yoga practice must be maintained. So if you do the yoga practice, they reduce the morbidity, mortality, as well all cardiovascular diseases. Particularly if you yoga practice, then means you have to strengthen your mind. That's very important.
and maintain the healthy body weight. And mind is everything. So that is very important issue that should be controlled, digitally put. And then apart from that, Dr. Chopra has barely mentioned out healthy diet and healthy body weight, healthy cholesterol, healthy sugar, healthy hypertension control. This is very important issue in all respect. So these that reduce the morbidity, mortality as a whole. And body weight must be maintained by the regular exercise. You have to maintain at least in 5 days in a week, at least half an hour to 45 minutes of walking is very simple. So that is very important. We ask our patient that when you are coming into my chamber, that you see your money is the mind, and you have to body weight to be controlled, regular exercise, severe all activities, and they reduce the mortality morbidity in the long run. So that is a consequence that I told you, that is the old age, the constitution of child. That should be maintained, keep in mind.
Okay. Thank you, Dr. Panja. And Dr. Venugopal, our senior past president, is here. So welcome you, sir. How you can think as we heard Dr. Bhattacharya about the technology has come up, like use of mobile apps and telemedicine or all those things. So how can you see the technology and other innovative ideas can help in controlling, preventing the problem in the community, sir?
Yeah, I think it's a very difficult question to answer straight away, but I have some suggestions. We are already using all the watches to identify your heart rate, cardiac rhythms, everything. But more important to me is incorporating technology into getting data from the community. See, as far as I'm concerned, Dr. Devabrata Roy's study was excellent, but then we do not have a translation of that data into India. So my suggestion is that if you are really talking about prevention, then that study should be extended to other states, keeping this as a pilot study and develop it into a national database. I think it's something which I think the CSI should think about. The other thing is the age group which uses AI is the 20 to 30, the executive class. In that particular segment, we do not have data. In Kerala, there was a study which compared doctors versus the technical staff in the various companies. And we found that the rates of hypertension, obesity, and diabetes were much higher in the technical group, that is the software engineer group, compared to our medicine students and postgraduates. So this sort of a comparison between professional classes has not been made. And probably with the advent of AI, this may be a area where the CSI can think about and bring out data also. See, without data, we cannot talk. So I think we need data on all these things.
Those things.
Particular target group that I am aiming is 20 to 30. That is something which the CSI should take a lead.
Okay, so there are challenges, use of mobile apps, telemedicine, artificial intelligence, and various wearable devices are being used for early detection and follow up these patients. So moving on to Dr. P.S. Banerjee, our other senior past president, sir, how can you see, because it all has a cost. So how can you see even for rural populations, those who are from poor background can have access to their health issues? How can you prevent and overcome these issues in rural population?
I think this is a very important issue. We already discussed when I was the president and I was secretary, that why not to involve the rural people through the panchayats and other organizations, whether they are NGOs or government organization, with the help of that social media as well as electronic media and AI. So they can get the basic knowledge. They know how to prevent the disease that is most important in this country, where there is a growing increase in the price of the different medicines and devices which are being used in the management of the cardiovascular disease. So that is why the education starting from the level, school level, and improving the preventive measures like improving the environment. That is very important because the more and more environmental pollution is there, more is the chance of the cardiovascular disease. So why not to have more greens at home as well as outside? And the people may have the advantage of walking in the trails because that will give a very good mental happiness when you walk along the trails as we see in the different first world country, which is lacking in our country. And I hope the government should also get this kind of ideas from the society so that in the city as well as in the rural area, there should be enough space within the forest areas like trails so that they feel and enjoy the walking as well as that will prevent the obesity, improve the work capability, and as well as prevent the cardiovascular disease.
Okay, thank you, sir. Thank you, sir. And now I'll request Dr. Tyagi, since you know whether it is a rural population or whether it is an urban population, how can public-private partnership can come in and help in promotion and awareness of these challenges for prevention of various health issues, especially heart diseases in our country?
Thank you, Professor Tiwari, for such an important question. And the CSI headquarters for organizing this symposium, very important symposium of a very important topic. I think there is an epidemic of cardiovascular disease, we all know, and it is affecting young at a very young age. And particularly, like you said, in the corporates, also it is the stress, hypertension, diabetes we are seeing a very high number of patients at young age having hypertension, having diabetes, and under stress. And when we do their test and find out that they are having similar and high risk factors, smoking, high dyslipidemia at a very young age. So there is a need for the participation of the government, corporate sector in spreading this message. And particularly, I would like to say that we need to begin very early. It should be part of primary school education, the education about the healthy diet, heart healthy, how to identify these things, like the pilot project has been started by Dr. Debrata. Very nice project has been started. So more national-wise awareness has to be created for these. And I think if it is made a small chapter in the textbooks of at every stage of the school curriculum, and particularly apart from the risk factors modification, the obesity modification, the identification of these children at a younger age would help us to control the disease at a later stage, that we all know very well. And as we are all also very aware, cardiovascular disease occur at a 10 years earlier in our country. Myocardial infarction occurs earlier, the extensive coronary artery disease. So we have to start this prevention at a very early stage, from the school age, college age, and involvement of all the stakeholders is very important. The awareness through the TV, like there was the awareness program of the COVID, when there was COVID. Similarly, this is affecting much more population, causing much more deaths. So similar type of awareness program should be made available on these medias. So I think this initiative of the CSI should go a long way in prevention of cardiovascular disease.
Thank you, sir. Thank you very much for your the vision about the participation of the other societies, NGOs, and other ways to help and reducing it. Now with me is also our current Vice President, Dr. Soumitra Ray. Sir, how does this lifestyle interventions, modifications, healthy lifestyle can become a model for this country for prevention of disease in India? Your views, please, sir.
Yeah, of course, as we are discussing, lifestyle modification plays the central role in preventive cardiology or in preventive health. And as you know that our government has initiated the World Yoga Day. We just observed 7 days ago the World Yoga Day. So this, and in all our CSI programs nowadays, we are having some yoga session in the morning
of some of the days. So I think this mental health is very important, along with the exercise, healthy eating, staying away from smoking and alcohol. But I particularly emphasize on the stress and strain aspect, particularly from the younger children, as Dr. Devabrata's project says, that the burden of school books and burden of curriculum and ambition and rat race, those will be there.
Yeah.
But if we
Yes,
can
I agree.
prevent most of those, that will take a long impact on our future society.
Okay, thank you. With us also is Dr. Kajal Ganguly. Sir, can you build on this, what Dr. Soumitra Ray has said regarding the lifestyle modification, and does it becomes the model for all over the Southeast Asia?
Yes, I fully agree. This lifestyle modification is very important because, as has been pointed out, that most of the cardiovascular diseases are lifestyle diseases, and we should stress on the people that we should take care of modifiable risk factors, and that should go a long way. And we should involve, as I said, it is a multi organization domain also. We should involve other organizations, other societies like API, that is IMA, who has got a broad spectrum of population exposure to fit this model to the not only to the urban people, but also we should take up to the rural people, and we should stop this lifestyle modification from a very early age, so that we can prevent in the long run the cardiovascular diseases.
Yeah, so now I will request our President Dr. Kali. Sir, how these policy changes are needed to make the preventive healthcare a national priority? I mean, at the government level, at NGOs level, how can these policy advocacy can help in controlling the challenges regarding the various health issues, especially the cardiac problem in the country? Sir, please.
Sorry, I have been noting that you have been moderating the session so well. Now, this private government partnership, what you told, majority are private sectors, and also there is a substantial participation from the government sectors. So we have to go hand in hand. We had some initial experience in 6 years back, I think, in 2019. And we organized a STEMI conference from all the secretaries, ministers from different states, etc., etc. And all of us were there, and we discussed about it. But to tell you honestly, that it didn't roll much. How to prevent the states? Every day, you, I, everybody of us are seeing that STEMI occurring at 30 years, 32 years. Even they are not sparing the ladies at 31 years. So that's a major problem, and I think it's not a very difficult issue because we have been pinpointing. I was listening to all our past presidents that we have been pinpointed the issue, and especially in the private government partnership issue, some of the schemes like the central government scheme and also at the regional stage, because not only we identify and prevention, but we have to treat the existing rural population. So I think never think of going to the big hospitals. They can go because of these schemes, both central schemes and also the state level schemes. So I think from the governmental level, there is a lot of penetration in the rural population and causes of that, and it put effect on the population.
I will request our Honorary Secretary, Dr. Sinha, sir. How can you see the doctors at the grassroots level? How can they promote the healthy lifestyle and various challenges? How can a small clinics in different, at smaller cities, districts can be created to solve the growing epidemic of heart diseases in our country? Sir, please.
That's a topic about which I'll say on at the very beginning. It's easy to say, but it will be very difficult to implement. Having said that, What are the most important risk factors for heart disease? Number one, of course, everybody will agree, is hypertension, blood pressure. At least all of our doctors and colleagues or those rural practitioners, they should be taught, trained and taught to measure blood pressure of every person, irrespective of whether he is a patient or not, above the age of 13 years, as per current recommendation. Their blood pressure should be recorded at each and every medical contact. And when it is medical contact, it is not a specific. It could be a patient's attendant. But that thereby we will get some idea about fortuitous assessment of the first assessment of the severe risk factors. That is number one point we can discuss, reach, and implement at the rural level. That will go to a large extent, to a very large extent, to prevention of cardiovascular disease. Starting with that, we can gradually extend up to the next step will be, of course, the control of tobacco. But it is again very easy to say and very difficult to do. And
Okay.
with these two steps, we can take care of the two very major risk factors for cardiovascular disease. If it is can be implemented, but we'll have to have a very great, large role to play in that. We'll see.
Okay. So I will request Dr. Majumdar, how you see the various health societies, physician societies, the Cardiological Society of India may become the advocacy role in making the various guidelines so that it can become a model all over the country and other countries.
It's a very important question. Now, for the last, I would tell, for 5 to 10 years, there is a growing concern of this branch of cardiology, preventive medicine or preventive cardiology. That is very important. Many discussions going on in various areas, and many doctors, many societies are trying their best. But the problem lies, the mass population has to be very much conscious. Only doctors cannot do, or our society cannot do. So this consciousness about the preventive part of the medical field should grow from the early child. A child who is 10 years, 12 years, he should know. So my suggestion may be to incorporate any chapter in the biology class or anything regarding this preventive. What is the importance? So anything which is embedded in the very early childhood.
Yes.
He will be much more conscious. So this part is also important, because in huge population like of our country, we cannot go in every year and measure PP in every year. So these doctors are there, village doctors are there, doctors are there. They are trying their best. Everybody knows these are the better things for prevention. But if we are able to make the conscious from the very early childhood, I think that will be
Okay. Thank you, sir. And the most important question is still for all of us globally is the challenge problem with the young persons, young population. So I will request Dr. Mandal, what is your message to the young generation?
Thank you, sir. Actually, this cardiovascular disease is a part of metabolic disturbance continuum. And this starts from intrauterine life. And whatever discussion is going on for last 1 hour, I think today is the doctor's day, not only our cardiologists are the doctors. And it needs some crosstalk between branches of medicines. Suppose an obstetrician is seeing a pregnancy-induced hypertension, they should not treat it as a mercury value, that we should control it. But this pregnancy, hypertensive disorder in pregnancy is also a metabolic stress test. Metabolic stress test means it signifies that the mother in future is also prone to have hypertension, diabetes, cardiovascular disease, stroke. And this child who is getting exposed to this, that child is also at high risk of developing metabolic disorders like diabetes, hypertension, cardiovascular disease in future. So then the role of gynecologists, they should counsel that mother and the child also that they should be looked after in future. And suppose a pediatrician is seeing a baby or child who is obese, childhood obesity is also that will be translated in future to be a bad metabolic consequences like diabetes, hypertension, cardiovascular disease. So in young, when the cardiologists are getting involved, it is already they are passing through 2 stages. Gynecologist may identify some of them, pediatrician can identify some of them. So all the crosstalk between these branches is very much needed. I will request the Cardiological Society also to get involved those branches also, that so that we can catch up them early.
Yes. Very important point you have said that. And it's a wonderful discussion with all my respected, my mentors, past presidents, our secretary, our international affairs executive committee members. So preventive health is not, it is just not merely a medical responsibility. It is not only a responsibility for the doctors, but it is a social movement. It is a movement one can start. And in that, the doctors, the other paramedics, and should be a strong communities create a healthier nation. So I think this is a very auspicious day, awareness day. I am really thankful to the headquarters, our president, who has given me an opportunity to moderate this galaxy of speakers. I'm extremely thankful. Over to the Secretary, Dr. Sinha, please.
Thank you, sir. That was a wonderful session. It is my proud privilege and honor to propose the vote of thanks on this special occasion as we celebrate the National Doctors' Day, commemorating the birth anniversary of Bharat Ratna Dr. Bidhan Chandra Rai, an exemplary physician, visionary leader, founder president of Cardiological Society of India, whose life continues to inspire generations of medical professionals. First and foremost, on behalf of the Cardiological Society of India, I extend my heartfelt gratitude to our Chief Guest, Dr. Chiranjeev Bhattacharya, for delivering an enlightening and inspiring lecture. Your thoughtful insights and inspiring words have reminded us of the indispensable role that education, research, innovation, healthcare, and technology must work together in building a healthier society. We are deeply grateful for your precious presence, despite your demanding schedule. It is at this point of time, I would like to announce all of our esteemed delegates, faculty members, and all our senior members, those are online also, that we are initiating a program called Heart for Heart, in which we will be examining the heart status, the health status, so far as cardiovascular is concerned, of all the cardiologists who are members of the Cardiological Society of India, in association with World Heart Federation. This project is on the planning stage. It has nearly finalized, and we will be doing it very shortly. Roll it out. I request all of you who get the questionnaire, please respond to it, and we'll bring up a database in which we'll look to the healers, because this year, World Heart Federation's theme is Heal the Healers. Yes. I extend my heartfelt thanks to our President, Dr. Dhiman Kahali, for his warm and thoughtful welcome address, and to our Secretary, Dr. Satyendra Tiwari, for skillfully moderating the presidential conference, which was the intellectual secretaries of today's program. I'd like to express our appreciation to all our past presidents, Dr. Mantosh Pandya, Dr. Anjana Datta, Dr. P.S. Banerjee, Dr. M.K. Das, Dr. Sanjay Taiki, Dr. S.K. Chopra, Dr. K. Venugopal, for their invaluable experience and wisdom enriching the today's program. I extend our gratitude to every member of the CSI Executive Committee, office bearers, faculty members, and delegates who have joined us today and contributed to making this celebration memorable. I would also like to place on record our heartfelt appreciation to about 350 delegates who joined us online. Let us carry forward the spirit of Doctors' Day with renewed dedication and a shared vision for a healthier tomorrow. Thank you once again. Jai Hind. Long live CSI.
Jai Hind. Long live CSI.
Thank you, sir. Thank you.
Right.
Okay.